Welcome everyone. In this upcoming video, we're going to talk a little bit about the skin. When we look at the skin, we'll see that we have this top layer called the epidermis, the layer just beneath it called the dermis, and the lowest layer, the hypodermis. Microscopically, we'll talk about the epidermis. The epidermis has 5 layers, especially if we have thick skin. The dermis only has 2 layers. It has this papillary and reticular layer. And this is like a 20-80 split here, like the top 20% of the skin, or the top 20% of the dermis is the papillary region, and then the lower 80% is the reticular region. And then way down at the bottom is the hypodermis. Now, the reason why we do the skin or the integumentary system as the very first system that we discuss in Anatomy and Physiology 1 is that we just spent time talking about the 4 different types of tissues. And the skin actually has all 4 types of tissues. In the epidermis, there's epithelium. And in the dermis, we're going to have connective tissue. And then we have muscle and we have nerve. So we have all 4 types of tissue in the skin. Okay. So here is the muscle. Right here is Erector Pili muscle. Let's see if it's, there it is, the Erector Pili muscle. The lamellated corpuscle and the tactile corpuscle and these nerve fibers, that's all nerve. That falls under nervous. Here's muscle. So you have nerve, you have muscle. In the epidermis, we have all epithelium. And then in the dermis, look, you even have, you have fat down here at the bottom. You have fat, you have blood vessels. This is all connective tissue. The 5 layers of the epidermis, they all have the word stratum in it. Stratum means layer. And from superficial to deep, there's a little silly mnemonic called share, loves, getting, skin, Botox. This is usually the last layer. Share loves getting skin Botox. Share for corneum, lucidum, granulosum, spinosum, and the deepest layer is called stratum germinativum or stratum basal. Okay, they're interchangeable. So it's either stratum basal or germinativum, and it's because this basal layer or germinativum layer, that deepest layer, is made up of stem cells. And these stem cells multiply and divide, and they work their way up. And as they migrate and they push and they work their way up, it actually takes 4 weeks to get up to the top layer. By the time they get up here, they're dead cells. They're stratum corneum. They're dead cells, and we could see that they're sloughing off. They just slough off here. Okay. So again, when we look at this under a microscope slide, we have the epidermis, which is on the top 5 layers, 1, 2, 3, 4, 5. 1, 2, 3, 4. Those are the 5 layers. And then you have the dermis down here. So you have epidermis. Again, they all start with stratum. And then we have share, loves, getting, skin, Botox, stratum corneum. Stratum corneum is like 25 to 30 layers of stratified squamous epithelium. Stratified squamous epithelium, many, many layers of stratified cells. And then the basal layer down here at the bottom, the germinativum, the basal layer, these are all stem cells. And you have all of these keratinocytes, these skin cells, the keratinocytes and melanocytes, all those different cells, Langerhans cells, all found within the skin. Okay. And then way down at the bottom, we have the dermis. And these little hills are called dermal papilla. They're part of making the fingerprint, if you would. So what is this highlighted layer of the skin called? That's the epidermis. Just below that, we then have the dermis. And then below that, we have the hypodermis. Again, epidermis, dermis, hypodermis. What structure is indicated by the arrow? So now we're looking at the skin. That's going to be the stratum corneum, right? That's the stratum corneum, right here. Now we go down a layer. Cher loves, right? This is the stratum corneum. Cher loves. So this yellow highlighted region is the stratum lucidum. We go all the way down to the bottom, that basement layer. It's either germinativum or basal. Don't be confused with granulosum. Nope, it's the stratum basilaire. Then we have those mountains, those hills. Those are called dermal papilla. Dermal papilla, these are involved in creating the fingerprint of the fingers. Finish up with nails. When we look at the nails, we have this free edge. We have the nail body, which is typically pink due to the red blood cells underneath. We have this crescent-shaped lunula. You have the empontium, known as the cuticle. And way back here is the nail root. And then posterior to that, there's actually an area called the matrix. And the matrix is where that would be equivalent to the stratum basilaire. It's all stem cells. And when these stem cells multiply and divide, they push up just like in the skin to push the nail up. So when we look from the side view, here's the distal phalange. We have the free edge of the nail. Here's the nail body. Here's the lunula. Here's the cuticle or the empontium. Here's the nail root. And then posterior to the nail root, that's the nail matrix. That's the epithelium that's proximal to the nail root, and it contains the dividing stem cells, and they're going to produce new cells. And when these things multiply and divide, it's going to push the nail upward and forward. Okay? So when we look here, this is going to be the nail body, right here. And right there, that's going to be the nail root. The nails are important in terms of health and looking at people during a physical exam. You can pick up a lot of diseases by looking at the nail. When we see this type of clubbing, right, when the nails club downward, like in here, very thick in the cuticle region, and then it really does club downward, pretty huge. We see these with COPD. We see it with lung issues, poor oxygen. We also see it with inflammatory bowel disease and cardiovascular disease. We see it with AIDS. We also see it with just poor oxygenation when you have decreased oxygenation with lung cancer, smokers, emphysema, different types of lung diseases. We're going to see this, as well as intestinal, irritable bowel disease. We'll see clubbing. The opposite of clubbing is like spooning, which we see here. Spooning is seen with severe diabetics and fungal infections. When we see the nail body, this portion here, and it's not pink, but it's pale, we're thinking anemia. Either iron deficiency anemia, or we're thinking B12 pernicious anemia. Okay, we also think it could be seen with malnutrition, either iron or B12, congestive heart failure, and liver disease. Most likely some sort of anemia. That's usually number one on the list. Then I look at the eyes, I pull down the lower eyelid and I want to see if it's pink or white, and I look at the tongue if it's pink or white. If it's anemia, they may be shortness of breath, they may be anxious, there's going to be fatigue, and then on blood, you just don't look at serum iron. You also need to look for something called ferritin. Ferritin. I just checked a few patients this week, very, very low ferritin, and it's because their number one complaint was fatigue. Their doctor checked their thyroid function, it was normal, but they never checked for iron and ferritin, and they were very, very deficient in ferritin, especially after COVID. COVID really depletes the iron. It just knocks it out, resulting in, especially in women, lots of hair loss. So most women that I've been checking, their iron and ferritin are very, very low. We could see this black line here. This is a type of skin cancer called subungual melanoma. See it primarily in darker skin individuals. When you think of skin cancer, you just don't look at the skin. You also have to look at the nails. It's a very, very dangerous type of skin cancer that you want to look at. These type of ridges, we call them candle wax drippings of the nails. We see these with metabolic issues like diabetes, thyroid disorders, Addison's disease as well. These are all endocrine conditions, mostly endocrine metabolic issues.